I will give the updates on the confirmed cases that we have. Right now it's at 64. Source of exposure, 13 are related to travel, 42 are related to a case contact, 9 are from community transmission, and 0 are still under investigation for that category. In regards to gender, there are 25 male, 39 female. In the age groups, we have 6 that are 0 to 19, 16 that are 20 to 29, 7 that are 30 to 39, 5 that are 40 to 49, 9 that are 50 to 59, 3 that are 60 to 69, 8 that are 70 to 79, and 10 that are 80 and above. In regards to our patient status, we have 5 cases that are in the hospital, 14 that are in a nursing/rehab facility, 15 that are isolating at home, 2 that have completed their isolation, 25 that are recovered, and 3 deaths. For medical visit, there are 21 that were tested at the drive-thru, 11 in a clinic or private provider, 6 at the emergency room, 9 in an inpatient setting, and 17 in a congregate facility. For the investigation status, we have 42 that are ongoing and 22 that are complete. We added the congregate facility option for medical visits because of the testing that happened at the medical launch last week. All right, I'm open to any questions.
Okay. Can you walk us through the timeline of the outbreak at the Midland Medical Lodge?
So we had an administrative staff that tested positive on the 3rd, and then additional administrative staff that tested positive on the 4th. I believe the 4th had 2 cases, the 7th had our 4th, and then when we had our first resident case, which was last this week, is when we decided to do the mass testing as well as speak with the facility about their isolation wing. And so they did assure us that they had the isolation wing to put their positive residents. And then again, we had the testing from MCH and also additional testing for everyone else by Midland Memorial on that Friday. And here we are today.
And I know this was asked by Mitch before. Can you, hold on, let me get back to it. Can you tell us the number of residents and staff who live and work at the medical lodge?
Sure. There are a total of 28 cases associated with the lodge. 8 of those are staff and 20 are residents.
Okay. Can you elaborate more on how the residents at the lodge were isolated once cases started appearing?
Sure. So once we started our investigations with the Midland Medical Lodge, which we have been in constant communication with them from day one, they assured us that there were no visitors coming in. It's just the residents that were there, and of course staff that had to come in to take care of them. Once the staff was, or once the resident was identified as being positive, we spoke with the lodge and actually had an isolation wing in place at that time, so they were able to move the patient there, and they have about approximately 30 beds on that wing, so they're able to isolate the patients that come back as positive, and they currently have an area where people that are negative but may be symptomatic, they can also place them in an extended isolation wing.
And then a question from the hospital's Facebook page. Is it necessary to wear gloves when shopping?
So the CDC recommends that you wear a face mask. Now, by no means is that a mandate, but if you want to prevent any type of transmission, any type of mitigation step or process, where it being a mask or gloves is recommended. And definitely washing your hands and having hand sanitizer on hand will help.
And is the health department checking on all nursing home assisted living facilities to make sure they're following procedures correctly?
That's actually a great question. We're working on gathering that list right now. I've been in contact with the Texas Health and Human Services Commission to make sure we have our complete list of our nursing and rehab facilities for Midland, and we're going through that list and we're making sure we have points of contact, make sure they know what forms need to be filled out in case there are any positive residents or if they have any questions. And we also make sure that they're going to be referred to reputable sources, which would be the CDC's website as well as the Texas Department of State Health Services website.
And this one is from the MRT. Do you consider the larger amount of testing at Midland Medical Lodge earlier? Maybe did you consider the larger amount of testing at Midland Medical Lodge earlier?
Can you elaborate on that question? I'm not sure what they're asking.
I think he's wanting to know, did you maybe think about testing the larger number of the staff and residents there before Friday?
No, and I believe Dr. Wilson hit on that question as to the rationale behind why we tested when we did.
And Mitch with Marfa Public Radio is asking, once multiple staff members at the nursing home began testing positive at the beginning of the month, should the hospital have been notified and should there have been mass testing?
Can you ask that again? I'm sorry.
Once multiple staff members at the nursing home began testing positive at the beginning of the month, so the administrative staff members, should the hospital have been notified and should there have been mass testing?
Yes, the hospital was aware of the positives. It wasn't something that was kept secret. Midland Medical Lodge, the health department, as well as the hospital have been on the same page since the first positive. We all had open communication.
And then the second part, which I know you touched on last press conference, but if you can just reiterate, it said, should there have been mass testing earlier?
No, there weren't. There were positives just with the residents. And as we said before, there wasn't any reason to test the patients, especially, or the residents, especially since none of them were positive. Once we did get a positive resident and they are in a congregate location, that's when we decided to do the mass testing.
Oh my gosh. Were any staff from Midland Medical Lodge working at any other facilities?
No, they stopped sharing the staff members once the governor put the changes in place for the nursing homes.
For those who have family members at the lodge, what should they do? Are they safer in the lodge or should they be moved out?
Oh my God.
The lodge has been in communication with the family members since our first staff member became positive. So family members have been aware, they've been made aware, and they have been communicating with the lodge. Now, with the patients that are, the residents that are in the lodge currently, it would benefit them to stay there, as most of them are there because they need additional care that maybe their family members are not able to provide. So the staff that is in the lodge is in place to be able to provide them with the additional or ongoing care that they need.
Okay, and for the sake of time, so we can get through the rest of our speakers, this is going to be the last question for Whitney. It comes from CBS 7. How many residents live at the lodge? Can you give us a sense of the ratio of how many are sick compared to healthy right now?
I believe they have 120 beds, and they have about 80 residents currently.
Okay, well, this will be the last one because that was a quick answer for you. Midge asks, how does the health department believe the virus spread from admin staff to the residents? And how many residents have respiratory issues or underlying health conditions that put them at a higher risk?
None of your concern.
So the